can I do following cataract surgery? It's our version of keyhole surgery or minimally invasive surgery, and the restrictions following an operation for cataract are relatively small. You can't get water in your eye for 3 weeks, and you can't rub your eye for 3 weeks, but otherwise you can carry on completely as normal. So you can bend, you can do exercise, play non-contact sport. For example, you could go to the gym or you could play golf, and most people would suggest within 3 days following their procedure. So it should have very little effect on the patient's lifestyle. I'll make a comment about driving, and the rule is that if you can see the number plate at the appropriate distance, then you're free to drive. So that might depend on you obtaining a new spectacle prescription if required, and that's usually done about 3 weeks after the last cataract operation. So overall, there are no real restrictions on lifestyle, and you can carry on completely as normal. It's just mindful of not getting water in your eye for 3 weeks following surgery is the principal risk or issue. So people often ask, can I bend down afterwards, and can I tie my shoelaces? And you can. Sometimes people, they want to pray, and they can do that straight away after cataract surgery. If they're doing things like golf, I would suggest having a 3-day break, and then they can start playing again. If they're playing tennis, then again 3 to 4 days. So really there's no major restriction on what people can do. It's key not to damage the eye or get a blow to the eye, so avoid rubbing the eye. And perhaps if you are playing tennis in the early post-operative period, to wear some form of protective glasses. So activities involving strenuous exercise can be done probably from 3 days following the procedure. Another thing that patients often ask is, can they fly? And again, there is no restriction on at any time going in an aeroplane after they've had cataract surgery. So other questions that are often asked are, can I wear makeup after surgery? And it's really the restriction about not getting water in your eye. So I advise patients not to wear makeup for 3 weeks following surgery. Not that there's a problem applying it, but it's the risk that you may damage the eye when it's removed. People also wonder whether they can fly in an aeroplane after surgery, and that's at any time following the operation, so there's no restriction on that sort of activity. So generally, one carries on with life completely as normal, but just avoiding water and rubbing the eye for that 3-week period after the operation.